Then, let's see the incidence, etiology, and pathogenesis of acute leukemia. Acute leukemia can be properly classified into acute myeloid leukemia, or AML, and acute lymphoblastic leukemia, or ALL. AML is more common in old age, while ALL is more common in children. The incidence varies by race and region. While in China, the morbidity of acute leukemia is 3 to 4 persons per 100,000. The ratio of males of females is 1.81 to 1. Among all tumors, the mortality rate of acute leukemia is the 6th in male and the 7th in female, but is the first in children and adults younger than 35. The incidence of AML increases steadily with age. Most cases are seen in 6th, 7th, and 8th decades. AML accounts for 15 to 20% AL in children and 80% AL in adults. The risk for developing ALL is highest in children younger than 5 years of age. The risk then declines slowly until the mid-20s and begins to rise again slowly after age 50. Only 20% of adult leukemias are ALL, but about 1/3 of ALL cases are in adults. For the etiology, the first is the physical factor, mainly including high-dose external ionizing radiation exposure, such as nuclear leakage. The second is the chemical factor, which is mainly related to AML, including chronic high-dose benzene exposure and bemelin. Chemotherapeutic agents which can cause DNA damage, such as alkylating chemotherapy for some other types of cancer, and even smoking. The third is biotic factor, including virus, such as the human T lymphotrophic virus 1, which is related to the adult T-cell leukemia lymphoma. And patients with autoimmune disease also have an increased risk of leukemia. The fourth is the hereditary factor. The identical twin of a child with acute leukemia has a heightened risk of developing the disease. On the other hand, patients with genetic disorders such as Down syndrome with trisomy 21, Fanconi anemia, Bloom syndrome, Bruton syndrome have a higher risk of leukemia. The fifth is the secondary AL, which means the leukemia secondary to MDS, lymphoma, multiple myeloma, paroxysmal nocturnal hemoglobinuria, and the others. Leukemia occurs in a multi-step process known as the double-hit theory. Generally speaking, there are at least 2 steps. The decisive changes of genes in a single cell caused by various reasons activate a certain signaling pathway, leading to the generation and aggressive proliferation of clonal abnormal hematopoietic cells and the arrest of apoptosis. The abnormal cells will divide uncontrollably, while the normal cells will get crowded out and are hard to leave, which causes cytopenia. Further genetic changes, such as the formation of a furin gene, may involve transcription factors that block or disrupt differentiation. The cells will stuck in blast stage of development. The blast cells don't function effectively, then leading to leukemia. Thank you.